The website is dogsandticks.com. Dr. Ruth MacPete is here, just happens to pop into the studio to talk about ticks. Here's the way that I think about ticks today, that if we were to do a population census of all the ticks and count them, 1, 2, 3, 3 million, 4 million, because we're talking that many ticks, probably more today in our nation's history than ever before, which means more tick-borne disease.
Yes, absolutely.
Why is that?
Well, ticks unfortunately are vectors for disease and they carry a number of different tick-borne illnesses. And a lot of people know about Lyme disease already, but they're unfamiliar with the fact that ticks can carry other diseases like Ehrlichia, anaplasmosis,
What?
Babesia,
Oh,
tularemia. So
whoa.
lots of different tick-borne illnesses.
Those names don't sound good.
No, they're not.
And they can make a dog, I'm guessing.
They can make them very sick. So they can produce a number of different signs and symptoms. But the important thing to mention is that a lot of these tick-borne illnesses don't just affect dogs and cats, but they can affect humans. And that's why it's so important that people know about ticks and are doing what they can to prevent tick infestations.
Before we talk about protection, which we'll do next, I want to ask you this, because we now know, I believe, that one tick bite, all those yucky long names you mentioned,
Mm-hmm.
babesiosis or ehrlichiosis and all the
Yep.
others, and Lyme disease,
Yep.
which is a biggie. The tick bites, and the dog or person perhaps is not getting just one of those, but perhaps a cocktail of several.
They could, absolutely. So it's hard to know what the tick is carrying. And the concern is that any tick can carry a tick-borne illness. And we don't know which tick at any particular time has a tick-borne illness. And we don't know which bite is going to be the bite that delivers Rocky Mountain spotted fever. And so that's why, again, that prevention and everything else is so important because ticks do carry a number of different important diseases that are problematic for pets and people.
All right. Now, I began by saying there are more ticks out there than ever before. And you said, yeah, so I'm
Yep.
going to talk about that. Climate, I suspect, is one reason. And also our exposure to ticks
Yes, yeah.
because of increased wildlife.
Yeah. And we're encroaching, humans are encroaching on the wildlife. So we're taking away more and more, of the environment where animals and ticks lived. And so we're really backing our yard up into that area. And so we're coming in contact with them. And then people have pets and those pets go outside and they're in the same area that a tick is found.
All right, so let's talk about that P word, prevention. What do you do?
Well, the first thing is that people need to be aware of it. So this is great that you're making people aware of ticks and tick-borne illness. We want to make sure people know what a tick looks like. There's a great website, dogsandticks.com, and it shows you what a tick looks like so that they're familiar with what these creepy little critters look like. We want people to also take advantage of the numerous preventative products that are available to help prevent tick infestations. None of those are 100% effective, and so you can still see ticks on your animal. And so that's why it's important that people, again, know what a tick looks like, that they get in the habit of checking their pet when they come in from being outside, and that they do a once over, rub down their pet and look for ticks. And if they see any, remove them promptly.
What are some symptoms of Lyme disease, which is a big one to look for dogs?
Well, some of the symptoms are an animal may have a fever, they may have fatigue or be lethargic, they may have swollen lymph nodes, they could have swollen joints, they may be limping. But it is really important to note that they may have no symptoms at all, especially early on. And that's why screening tests that are available at your veterinary hospital are very important. Screening tests allow veterinarians to detect tick-borne illnesses early so we can start treatment right away.
And that's really important because sometimes we just say, well, it may be an older dog, an 8, 9-year-old
Mhm.
dog. Well, the dog's just kind of getting old. And that's what you think rather than the dog just isn't feeling well in the
Yes.
case of an older dog. Or maybe you're thinking it's arthritis, and our mind goes in one
Yep.
direction because you said, for Lyme disease is a great example because some dogs will limp
Well,
as a
and
symptom.
that's the thing is that these tick-borne illnesses, one, they have subtle signs of illness. Sometimes they have no signs at all early on. But the other thing is they mimic other diseases. So you bring up a great point. They mimic things like arthritis. They mimic, a number of different things. Some of the tick-borne illnesses can cause kidney problems. So you may think that the dog dog just has kidney disease, which may be true, but it's actually caused by a tick-borne illness. So they can have CNS signs. So, again, it's really important that we do these screening tests because it enables us to actually determine that the root of the problem is a tick-borne illness.
Yep, which makes testing very important. Prevention, most important of all, if you
Yes.
can.
Yes.
Dr. Ruth MacPete, thank you so much.
Thank you very much.